Over the last 6 years, 6 different guidelines for exercise and pregnancy have been published. And I want to cover some of the circumstances that a small number of women face that would justify having a conversation with their healthcare provider regarding exercise safety while being pregnant. This information is coming from a Canadian pre-screening tool that I had the opportunity to contribute to while I was serving on a committee for the American College of Sports Medicine. This tool is the Get Active Questionnaire for Pregnancy, and I've provided a link to it down in the description below. There are 13 health conditions and a few other special circumstances that will require meeting with a doctor to determine exercise safety during pregnancy. These include respiratory or cardiovascular disease, unstable epilepsy, unstable type 1 diabetes or blood sugar that's outside of a normal range, unstable thyroid disease or function, an eating disorder or malnutrition, twins or expecting other multiple births, anemia with high fatigue or lightheadedness, high blood pressure, if your baby is growing more slowly than usual, unusual bleeding, a ruptured membrane, going into labor before 37 weeks with your current baby or with previous babies, having weak cervical tissue or a tape that reinforces the cervix, if you've had previous miscarriages, if you have a health condition that limits your ability to be physically active, or if you generally have any other concerns about exercising while pregnant. If you don't have any of the conditions that I just mentioned, you should be active during pregnancy to protect yourself and your baby. Make sure that you're achieving a minimum of 150 minutes per week of moderate intensity physical activity. Yoga can be beneficial, and the combination of strength training and cardio, and this means doing activities like walking, swimming, biking, that's going to be more effective health-wise for you and your baby than if you're doing strength training or cardio on their own. It's best to be active every day, but make sure that you're targeting for a minimum of 3 days a week. Sometimes during pregnancy, women accidentally leak urine. If you want to prevent this, practice Kegel exercises or pelvic floor exercises, and you can do this on a daily basis. Sometimes when women do exercises while they're laying on their back, they start to feel a little sick. So if this happens to you, change the position of the exercise. To maximize the health benefits for both you and your baby, as long as it's safe for you to do so, make sure that you're doing a combination of cardio and strength training before, during, and after pregnancy. Thank you for watching.